I'm Falesha Houston, an improvement advisor with the Training and Implementation Program at the National Center for Child Traumatic Stress. Working on multiple training initiatives has led me to think about how we collect metrics and what information we include. How are we using the information we collect to further understand the outcomes, and what are we hearing from the communities we serve? My curiosity led me to think about how to incorporate qualitative data for a richer, more contextual understanding, given time constraints often present in our programs and how intensive qualitative analysis can become. I explored the literature on rapid qualitative analysis approaches. Rapid qualitative analysis can best be described as a hands-on qualitative approach used when findings are needed quickly to inform practice. It has been used in health services, public health research for emerging epidemics, as well as the U.S. Department of Veteran Affairs. There are many different approaches available that are considered rapid qualitative analysis, or RQA for short. So I've shared some of the literature in the comments, and I'm happy to share more. Please feel free to reach out. What stuck with me are ways that it has been used to include the community or family voice in the initial formation of a project. For example, one article I found used the quick turnaround to improve the delivery of a care coordination intervention for rural veteran communities. They were able to interview community members as well as care providers and use this information quickly to change how they implemented the intervention. This way, they were able to understand the needs of the community and ensure that the intervention is relevant. Here at the National Center for Child Traumatic Stress, we began a suicide prevention and healing initiative in late 2022 using a similar approach. We began by holding listening sessions both internally with staff and externally with members of the National Child Traumatic Stress Network. In order to do this, we came up with a list of questions from the research on suicide prevention that would help us understand the issue more deeply. Some questions were about their perspective on suicide prevention, who we need to partner with, what is most important to address, how do we challenge disparities, and what ways could we maximize the community voice. We took notes from each listening session and coded them using a lengthy process over the course of many months with the support from our data and evaluation program. This information was used to create a picture or a graphic of the journey that a family takes through the system from even before a crisis to after. It also helped us decide what information we need to know about the different stops along that journey or phases or pieces of the process. We had 2 community think tanks scheduled back to back in September and November of 2023, with the first informing the second. So we would need to turn over information quickly. I was a little worried about this, so I started looking into rapid qualitative analysis, or RQA, and found some great resources, including an article on rapid versus traditional methods, as well as some of Allison Hamilton's work. I like the idea of creating a matrix from the information we had already coded. I created a table or matrix along with a very basic codebook table to help anyone coding in the moment. I knew we would need to code the notes from the first think tank and that this would require each small discussion group to have a note taker and a coder. I created short videos to help train the note takers and the coders in advance and sent them the templates I had created for the notes and the coding. After the first think tank, we posted the notes for participants to review and make changes. We really wanted to make sure that the notes reflected the conversations from their perspectives. From here, we reviewed the coded notes and the notes from the note takers to make sure we were not missing anything. This was used to inform the discussion for our next think tank. We did not use the coding method at our second think tank, but still made the notes available to participants after. All of this information was used to create the collaborative change framework for the Collaborative on Suicide Prevention and Healing. This can be found on the NCTSN website. So to recap, what did I learn from this process? 1, use previously coded notes or the literature to create your matrix for coding. 2, you can apply an implementation framework to help, such as CFR, the Consolidated Framework for Implementation Research, or others, or many out there. It really helps to think about the different factors, such as the inner and outer settings, and different pieces of the implementation process. 3, have a team of coders that you train in advance. I really appreciated having a team of coders rather than doing this over the course of many months, and also was grateful to the participants from the think tanks who reviewed the notes and made suggested changes just to make sure we get it right. So 4, continue to include the community in the process. 5, I would use this method again anytime I need information quickly to inform a process or next step. I wouldn't necessarily use it for scientific publication, but definitely to inform implementation. I'm sure there are ways that I could have done this better for publication purposes, but that wasn't necessary for this particular project. I hope this helps you in your implementation endeavors. Check out the resources below, and thank you for watching.